Welcome back. Today's topic is on frontotemporal dementia and the third part of the 6-part dementia series. Rather than covering all types of dementia in one video, I have divided this into 6 individual parts so you can watch the one you are interested in. Frontotemporal dementia, as a short called FTD, is an umbrella term for a group of dementias that mainly affect the frontal and temporal lobes of the brain, which are responsible for personality, behavior, language, and speech. Unlike other types of dementia, memory loss and concentration problems are less common in the early stages. Most common of FTD are diagnosed in people aged 45 to 65, but it can affect younger or older people too. It is a rare form of dementia affecting around 1 in 20 people with the dementia diagnosis. Then what causes dementia? It is not known why this occurs, but it is thought to have a genetic link in about 1/3 of people with the diagnosis. In FTD, there is an abnormal buildup of proteins within the brain, which damages the cells. There are 2 types of FTD. One is behavioral variant FTD, as a short is called BVFTD, or other is primary progressive aphasia, as a short we call it PPA. The symptoms of BVFTD are difficulty focusing on tasks, reduction in motivation, lack of interest in things the person used to enjoy, difficulty with planning, organizing and decision making, lack of awareness of the changes in themselves, that's like a lack of insight, then behavior changes. That is making suggestive comments without realizing, staring, or being over familiar with people. The next one is reduced empathy and obsessive or repetitive behavior. The example is repeating phrases or gestures or even hoarding items. The next symptom can be changes in behavior regarding food or drink. The example can be overeating and craving certain food, most likely sweet foods. The symptoms of PPA are, there are 3 types of PPA, which all tend to affect language rather than behavior. These are SD, PNFA, and LPA. The first one is semantic dementia, or the short SD, also known as semantic variant. In SD, the symptoms are the person forgets the name and purpose of common objects. Objects like keys, what is a microwave, and what are cattle and what does it do. They find it difficult to remember, find or understand some of the words. That leads to a gradual loss of vocabulary. As SD progresses, the changes are likely to become similar to those experienced of BVFTD. The second one is progressive non-fluent aphasia. As a short form is called PNFA, also called non-fluent variant. The symptoms are difficulty using speech, including forming sentences and using grammar correctly. Difficulty conducting conversations. Example can be hesitation, using shortened sentences, or using the wrong words. The third one is logopenic aphasia or logopenic variant, as a short called LPA. In this type, the symptoms are difficulty finding words, stopping speaking mid-sentences as they search for the right word. Unlike in SD, people with early LPA are likely to forget the meaning of words or what common objects do. After discussing the types and symptoms of FTD, let's look at the diagnosis of FTD. Its diagnosis is not that straightforward and can be difficult due to some of the reasons. Reasons like mistaking signs for other conditions such as depression, work stress, and relationship problems. The misconception that dementia only occurs in older people and usually involves memory problems. Then the person's reluctance to seek medical advice. This may be because they lack awareness of the changes in themselves or are afraid of dementia diagnosis. However, if you are concerned that someone may have FTD, it is important to encourage them to see their GP. After covering the diagnosis of FTD, now look at its management. Currently, there is no known prevention or cure for FTD. In some cases, medication may be prescribed, but this is not always suitable. It is often best to focus on practical strategies to help the person live as well as possible with the diagnosis. For example, follow a daily routine to help the person feel more relaxed. Try to avoid triggers like noisy or crowded places. Changes in routine, misunderstandings, boredom, physical inactivity, or pain. Encourage the person to continue activities and hobbies they enjoy. If the person overeats or craves sweet foods, offer food at set times. Try to control portion size and provide healthier options. Remember that the person is not intentionally causing upset or offense. Rather than challenging or correcting them, try to stay patient, calm, and empathetic to reduce distress. It is also useful to encourage the person to carry a form of identity with details of their diagnosis. This can help in public situations where there may be misunderstandings or a need for extra support. If the person has communication difficulties, ask their GP or specialist for a referral to a speech and language therapist for assessment, advice, and support. If you found today's topic useful, please like, share, and subscribe. Thanks for watching.